Hello, this is Dr. Newman, your doctor in the family, and I've been talking about patient advocacy at end of life, and I wanted to talk about a term that I've coined called displaced suffering. This is when you rid yourself of suffering or pain and displace it to your loved one. I frequently see it in patients who have been diagnosed with a serious illness. Sometimes it's very innocent, where a patient's loved one is saying, could they please keep going for me? Please, mom, keep going for me. Even though mom has said she's tired, she's suffering too much, she's in too much pain. I've also seen it in reverse, where a patient displaces their suffering. They don't want to make a tough decision. So the father will say, whatever my daughter says or whatever my wife says is what I'll do. And a lot of times, this to me is an unkind act because you don't want to suffer, so you give it to someone else. And I think it's harder when it's a loved one displacing it to the patient because the patient is in a vulnerable state. The patient is the one who is suffering, who's uncomfortable, who has the burden of a serious illness, but the family is still displacing this suffering or displacing hardship to them. And most of the time, it is truly, truly innocent, and it highlights just a patient and their family's pattern of decision making. Sometimes this pattern of decision making can create tension, and sometimes it can be healthy. And that's perfectly fine. But it's important that as we have these conversations, that we remember not to displace suffering, especially if it's displaced to the family member. So if you are experiencing displaced suffering within your family, because of a heavy decision, because something has shifted your family member, whether it's a serious illness diagnosis, whether it's a change in a uh, family status, whether it's a marriage, whether it's a birth of a child. If you're experiencing displaced suffering and it's creating tension, I think it's important to get help. If it's a serious illness, I would ask for help from your medical team or see if the facility or your organization has a palliative care team that could come in and have a family meeting. You also may need, if it's very serious, help from a therapist or a mediator if it's legal, but it's important to get help if it's creating tension, and we are passing the suffering back and forth to each other. If it's healthy, meaning I recognize I have displaced suffering. I really want mom to do this for me. I really want her to keep going for me, but I also see her suffering. If you're making that decision from a healthy standpoint and going to say, you know what, mom, whatever you want to do is important, then I say keep going, keep having those healthy decisions. Say, I really want you to keep going, mom, but unfortunately, I know that I can't have what I want because you're uncomfortable and you're my priority. That is to me, the antidote to displaced suffering is that you keep the person who's in the vulnerable state the top priority. They are most important. They are the ones who really need our help and we are advocating for. And so while we can state our discomfort, asking them to carry our discomfort or help us get rid of our discomfort is where the rubber meets the road. So I say keep prioritizing your loved one. Keep having these conversations about things you want and don't want. Keep having these conversations about how you're hurting, how this feels, and how you want help doing it. And most important, advocate for your loved one so they get the care they want and not the care they don't want.